HIV/AIDS, which by the late 1980s had come to dominate media stories in the United States concerning a growing epidemic, has ever since remained a consistent topic of American and increasingly world health officials as the disease has spread globally, particularly throughout sub-Saharan Africa and Central Asia. What is less talked about, however, is the sharp contrast in how certain populations are much more likely to contract the disease, in particular the homosexual community, compared to the general population. Despite less than 1% of the American population having HIV, the disease receives over 5 times the funding per person as does cancer, which is more than 10 times as common, raising questions as to why a special group receives such disproportionate funding over others.
Well, I'm not a crook. I've earned everything I've got.
The military-industrial complex.
A new world order.
But we are here to destroy the control over the industry of other people.
I did not trade arms for hostages.
It's been time stealing.
На полный разгром гнусских захватчиков.
Myth20c podcast.
Welcome to the Myth of the 20th Century. I am Hank Oslo. I'm joined by several excellent co-hosts here. We have Adam Smith.
Hey, everyone.
We have Hans Lander.
Hi there.
Nick Mason.
Hey.
And joining us is a very special guest, Kathy Princess.
Hello, guys.
So today we're going to be talking about HIV, AIDS. You may know it as GRIDS in our local colloquialisms. This sort of world-ravaging disease spun as this sort of epidemiological apocalypse that obviously has a lot of linkages with certain subpopulations in the U.S. and abroad, notably homosexuals and intravenous drug users. But it sort of has this sociological effect as well. Like if you grew up in the 90s, certainly, or any time thereafter, like there's this constant drumbeat of like, watch out for STDs. Like you can get HIV if like a girl looks at you with love in her eyes. Anyone can get it, etc. And you also had a series of kind of case studies in what happens when you have a really spooky set of deaths happen in like a very tightly knit and actually fairly prosperous and rhetorically sophisticated subpopulation. So we can start by talking about like the first kind of place where HIV sort of makes it onto the radar. In 1976, you have this sailor, this Norwegian sailor, Arvid Noah, who dies of just kind of like everything at once, honestly, like joint pain, lymphonemia, lung infections, eventually pneumonia. He had been a Norwegian sailor, and he was evidently banging whores in every port that he was visiting in Africa, which turned out to be his ultimate demise. And one dead sailor who dies after having banged a bunch of bar sluts in Nairobi, not a big thing. Then you have the next sort of reported case that we're able to identify. This Danish physician, Griffy Rask, I guess was performing some surgery in Africa again, and managed to come down with a set of symptoms, the same sort of very conflated, could be anything. Diarrhea, swollen lymph nodes, weight loss, fatigue, and then, pneumonia and death. And these aren't really linked together, but there's starting to be a cluster that gets sort of identified in retrospect. You have some prostitutes in San Francisco actually giving birth to some children who die fairly rapidly from various immunological circumstances. You have a Portuguese guy who sort of dies of the same cluster of symptoms. But these are not really constructed into a thing. They're just like random deaths. People die of pneumonia all the time. But we later seem to like identify that there is probably some nexus in Africa from this sort of stuff. So, Kathy, what's the sort of like genesis? Like, why do you see like this cluster of stuff seeming to like pop up in Africa very sporadically?
Okay, so I guess we can go into a little bit of a back history of HIV then. So there's basically two types of HIV, HIV-1 and HIV-2. And HIV-1 is the one that is the cause of the vast majority of global infections. And this strain of HIV is closely related to a virus of chimpanzees, which are sort of live around the Central African region, Cameroon, Equatorial Guinea, Republic of Congo, and the Central African Republic. While HIV-2 is mainly confined to West Africa, and that's sort of around Guinea, Senegal, Sierra Leone, Liberia, etc. So basically it's, apart from a few kind of kooky conspiracy theories that we can go into a little bit later, it's basically solid evidence that that HIV evolved at some point from the closely related simian immunodeficiency virus, or SIV, and that was transferred from non-human primates to humans in the recent past. So it's not quite clear whether SIV was transmitted and then mutated, or whether it mutated and was then transmitted. But that's so that's that little bit is unclear. But
so is it like people eating the monkeys, or like I've heard like kind of people jokingly refer to more sort of familiar methods of transmission of sexually transmitted diseases, but
that would be funny.
Those seem to be dark jokes to me.
Yeah, I think that's probably not a very likely mode of transmission, because I think we'll discuss this later on, but it's HIV is usually transmitted from the penetrative partner to the receptive partner, and transmissions the other way around are extremely uncommon. So I don't. So in that kind of with that in mind, I don't really see a way of the virus having passed on, except for eating bushmeat. And it is convincing that that's probably what happened, because in Africa people do consume a lot of monkey meat, a lot of ape meat, and catching and killing apes is not very easy, and you're likely to get some sort of fluid, blood from the chimp going, passing into the hunter. So
well, I noticed the odds of
process as well.
I noticed the odds of catching HIV are very, very high if you have a blood transfusion, and I don't know if that's similar for ingesting it, just eating the blood. But does it make a difference if you cook the meat? Were they eating these animals raw? How did they actually contract it if they're cooking the animals?
Undercooked sort of bloody meat would be one way to do that. You can also sort of catch it while you're preparing, butchering the meat. So if you cut yourself while you're butchering an infected chimp, then that's,
or you've
that's
got like kind of co-infections. You've got somebody has like an ulcer, so like now you've got basically a wound in your stomach, or like you've got you've like fucked up your hands earlier, like tromping through the bush. You've got some scratches. You're covered in monkey blood.
Right.
Yeah.
I had a question also about going back to when people were starting to die, but it wasn't clear from what, because people do die all the time. I'm wondering, Kathy, if you know how the pathology or the kind of detection of the disease was discovered. How did they go about that? Is there an autopsy done on people that is then uploaded to a database where people start looking for patterns? I'm not sure what the right term is, but how do they identify these things?
The way to identify sort of the way to diagnose kind of historical cases would be through banked tissue samples, blood samples, etc. So if you do have somebody who dies of an unknown cause, especially kind of one that's potentially due to some sort of infection that hasn't been described, then you would store their blood and their tissue samples, and you would, ever so often kind of go back and recheck it using, a newly developed technique or something like that. So, I mean, the way HIV is diagnosed in this day and age is twofold. So you can either use a very, very sort of basic immunoassay, which is basically you spot some blood onto a card, and the card has antibodies stuck to it, anti-HIV antibodies, and then if you have HIV, then obviously you'll get a color change, sort of a pregnancy test type of test. And then a more in-depth test would be using DNA techniques to try and amplify the HIV genome if it's there, and you can do that pretty successfully. So that's how you would taking blood from a tissue store, in the 1970s, you could go ahead and do that and find something.
Right, but they didn't know what to test for back then, so there must have been some kind of classification of the different strains of, I guess, viruses or external organisms that were in the blood. Is that roughly correct? I don't know how the process works, but I'm trying to figure out, because they knew nothing back in the 70s. Yeah. So how did the first researcher start thinking that this might be something new? That's a very interesting thing.
Well, because HIV is so the way it causes the sort of the pathology of AIDS is quite typical of something that could be caused by a virus.
Okay.
So I think that's why the researchers first hypothesized that it might be a virus that's causing it, and then they went back and looked for a viral footprint. There's various different ways you can look for a virus. You can look under an electron microscope. You can do DNA analysis, all sorts. So so you'd because the way when a person first contracts HIV, you get you do get a fever, and you get this kind of primary infectious period and a primary sort of response to it. So it's kind of like, in a way, getting some sort of mild something like a rhinovirus, something quite mild, but and then obviously it goes latent. So in that period you can't really find it. But there's also other viruses that don't quite have this kind of effect, but they also have latent periods as well, and then after a while they'll cause a cancer or something like that. So it's when the kind of the idea of HIV of AIDS was being kind of established as a thing, I think people started looking at the possibility of a virus quite early on.
Correct me if I'm wrong, but HIV can lie somewhat dormant in your bloodstream for up to like 7 years without symptoms showing.
There's people who can have it dormant throughout their entire lives.
Right.
Extremely variable, and it depends on your immune system a lot. As we know.
Oh, just real quick. There was a documentary on steroids. If it's good or bad for you, is it all a myth? And there was a guy taking steroids who had AIDS, and he said it helped him, and I guess that kind of boosts the immune system or something. But he had been living for many years with this disease.
Now it's completely, it's one of the more treatable sort of like chronic conditions. But even back in the day, like, I mean, I've seen kind of varying estimates of how long from initial HIV infection you can go before you start exhibiting any symptoms at all. And I've seen numbers like, you know, anywhere from 5 to 10 years or longer. So, like, you know, this is the spooky thing about epidemiology, and why, like, you know, you read more of these stories and you start really just wanting to jack up funding for the CDC, because it's like, you know, something happens in the mid 70s and then 5 years later, the shit hits the fan, and nobody really knew what to be paying attention to in the meantime. But so this does, after some of these kind of like early cases of like direct transmission, at some point somebody seems to make their way to San Francisco, which at the time, there's this guy whose name will pop up again and again. He's basically like the like godfather of San Francisco homos, Larry Kramer. He's actually a very well-respected author. He's written a fair amount of kind of interesting works, many of which have been adapted into movies and plays. One of his earlier books really gives a flavor for, which is perhaps an unfortunate word, for what was happening in San Francisco at the time. The name of the book is Faggots, wherein it details the sort of, and this is 1978 that this is released, so literally just on the cusp before AIDS starts to become a thing. And it details the sort of extremely nihilistic blend of circuit parties, these random homosexual hookups, taking of party drugs, intravenous drugs, your amyl nitrates, every form of sort of degeneracy that you can imagine. Which even in the book, he details how this leads to sort of these this sort of wildfire pattern of STDs, where like people come down with gonorrhea or chlamydia or syphilis or what have you, and you know, these things are all fairly treatable at the time. You get your shot of antibiotics, and you apparently don't pay that much attention to it, and you keep on partying.
Apparently, his book was actually panned by both the sexually normal and faggot critics. And I guess in the case of the homosexualists, they were upset that he was reminding people what it is that homosexuals actually do. That they were almost incredulous about the extreme nature of homosexual promiscuity.
Yeah, so MPC has a great ongoing thread regarding this, which is the Institute for Advanced Homophobia. I would recommend everyone, we'll include a link, everyone goes and just peruse through that. And the Two Kevin's show also recently did a show on this topic, and the gay community is full of subcultures of just various kinds of like sexual deviancy, and one of those being this idea of bug chasing, where
that's a interesting phenomena.
There's a subculture within the gay community where people directly seek out an attempt to, I guess, infect themselves with varying kinds of STDs. This goes to the theory that once you engage in more and more deviant sexual behavior, you have to keep upping the ante in order to satisfy your urges. So at some point, just being gay and just doing wild gay sex parties isn't enough to get you aroused. You have to think about being infected with a potentially deadly destructive disease in order to just become excited.
That's one sort of attribution of it, of that phenomenon. Like, I've heard the second explanation be that, you know, I think like as sort of a prereq to that second explanation, like should talk about what sort of like starts happening circa 1979, 1980. So like you're in a particular, like, place yourself in the mind like of somebody in this particular subculture in San Francisco, and all of your friends start to just get the flu like around about the same time, but they don't seem to get any better. And nobody knows what's going on. Like, why does everybody have the flu? Why isn't anyone getting better? And then they all start to get pneumonia. And then they start to get sores, like popping up on their faces. And still nobody knows what the hell is going on. And then they start actually dying. And
yes.
It's completely unclear. It's like a serial killer is stalking this group of people. It's like completely invisible. It's diseases that aren't novel. They're just diseases that nobody should be dying of. And so there's this enormous sense of apprehension and trying to figure out like what the hell is going on, like what should be the response. Is there a response? And this sort of amount of anxiety, like I've heard the explanation of bug chasing be that it's like a attempt to sort of resolve this anxiety by like essentially being known that you're fucked, rather than having the risk on every occasion. You just sort of get it over with, so to speak.
So there in 81 and 82, there was the sense of clustering we're talking about starts to become apparent. So you mentioned the pneumocystis carinii pneumonia, the PCP, which was found like you had like 5 gay guys in LA who basically contracted this really bizarre lung infection. And then at that same time, you were getting reports of people around New York and California, presumably San Francisco, with a cancer called Kaposi sarcoma. And by December, they were already determining one of the major clusterings of the rise of PCP was in people who were injecting drugs. Now, by the end of that year, there was like 120 gay men had died of some kind of bad immune deficiency, or their immune system was completely shot. They couldn't even resist like a common flu without dying or falling into severe critical status in a hospital. And then by June of 82, the number of like SoCal gay guys with this sort of immune deficiency had exploded. And so this is where the term GRIDS comes from, gay-related immune deficiency syndrome. But then by the end of June, they were also finding that the disease was in hemophiliacs and Haitians. So then they thought, okay, maybe it's coming from Haiti. And then by September, the CDC had coined the term AIDS, which is acquired immune deficiency syndrome. And the CDC thought it was a disease at least moderately predictive of a defect in cell-mediated immunity occurring in a person with no known case for diminished resistance to that disease.
Which is not like a very sort of diagnostically specific diagnosis. It just means like you get sick from something you shouldn't be getting sick from.
Right.
In the early days before that, because that was in what, 1982, you said?
Yeah.
Before that, it was called GRIDS.
Yeah. So the term GRIDS came about in 82. And then by September of the same year, or June of 82, by September of the same year, the CDC was using the term AIDS to describe it. Whatever this was, and I think Kathy can speak to this, it's intentionally vague. Like they're not really describing much, just that there's a bad immune system.
Yeah. I mean, that's kind of the sum total of AIDS really it is, and because HIV obviously attacks the T cells, that's where it replicates, and that's where that's what it destroys. So the immunodeficiency aspect of it is pretty central. And interestingly enough, the virus was actually isolated a year later after the CDC called it AIDS. So in 1983 in France, interestingly enough, and it was from a patient who'd had symptoms. It's from a patient whose symptoms were typical of that somebody with somebody with the patient whose symptoms preceded what the researchers by then knew would be AIDS. So a kind of a typical viral infection, and so yeah, it's I can see kind of why people think, well, there's so many different things that can be AIDS. You could get pneumonia, you can get Kaposi sarcoma, you can get all sorts of weird encephalopathies. A lot of people with advanced AIDS get dementia. Even people with quite well controlled AIDS can get dementia as well. So it's a whole variety of different diseases, but the mechanism of how they come about is pretty straightforward and pretty universal.
Yeah, so by 1981, it's really clear that this is a thing. There's some sort of general syndrome. It seems to be concentrating on gay men and intravenous drug users. It's still, it's probably some sort of infection or some sort of cocktail of infections. But again, it's just the lack of clarity is astounding. So in January of 1982, you have the same fellow we talked about earlier, Larry Kramer, founds this organization, Gay Men's Health Crisis, in San Francisco. And what this organization tries to do, it's fundamentally like an education and outreach organization. So they're like, we know almost nothing, but here's what we do know, and let's try to sort of communicate this to our local community. We know that it seems to be sexually transmitted. It seems to be affecting this group of people. We're in contact with these people, these doctors or CDC folks or whomever, etc. And the proposal is made that perhaps we should stop banging until we figure out what the hell is going on. Not in quite as straightforward of terms as that, but there's sort of a suggestion made that so you have, for instance, you have something that looks like an STD, and you have these bathhouses in San Francisco, which are basically just these notorious days-long anonymous orgies. And if you have an STD that's killing people, maybe you don't want that transmission vector. So this suggestion, originally comes from inside of the gay community at the time, or at least one faction of the gay community. And another faction takes severe umbrage at this suggestion. Who's the fellow besides? Yes, Bill Krause. So this guy, Bill Krause, in San Francisco, ends up being one of the primary advocates of shutting down the bathhouses, for which he is labeled, I guess, in a non-complimentary fashion, as a sexual Nazi who wants to put gays back in the closet, etc., etc., etc. He is, of course, himself a homo. So you have this sort of this tension within the community of like this sort of nihilistic death cult aspect, and then the faction who sort of, you know, wants to at least attempt some sort of a response to this that may involve modifying one's own behavior.
Well, is it just a time preference thing? I mean, the more death-bound nihilistic faggots are just trying to get as much in now as they can, and the others see the disease as an obstacle to future faggot gratification. Is that correct?
Yeah, I mean, like, I think that's definitely it. Like, you have all these like epithets like thrown around that like, oh, you're self-hating, like you want to get back in the closet, etc. But this is like, you know, this is why I moved to San Francisco, and like now you're telling me like, the bathhouse is closed.
So the homosexualist identity had been fully established by the 70s period in San Francisco.
There had been like a subculture, but you know, now it's starting to become, I mean, once you have like that concentration, they start to develop like as you said, this identity. They form social structures, they form organizations, they start helping each other get jobs and employment, housing, etc. You like have the emergence of like a semi-explicit gay mafia in certain business sectors. So like this is a thing by the 80s. It's been a thing for like, you know, at least 10 or 20 years.
Now, one question, I mean, this may be something you'd rather answer later, but this is one of the big questions I had, is the relationship between the general pushing of acceptance of homosexuals, open acceptance of homosexuals, and the spreading of, you know, quote, awareness of AIDS, or, you know, the gay men's health crisis, as if being a homosexual is not in of itself a health crisis. But do you get where I'm coming here?
Yeah, like it's the tension between like emphasizing that like there is like actually this, you know, horrible disease that's like associated with the gay community, but also they're just like us.
Well, okay, so even growing up in a extremely paused metropolitan area, I seem to recall hearing more about like AIDS than about the plight of the homos. I mean, I heard a lot of AIDS propaganda, you know, raise awareness, and
that was like a conscious strategy of like a later group, ACT UP, and some of the other ones to sort of decouple AIDS and homosexuality. So like it's this two-stage thing where at first, like, you know, obviously it is like primarily at first a essentially gay disease, and so like the primary people who are going to be concerned about that are going to be gays, and they're going to be concerned because it is a gay disease essentially. And then later, as you attempt to like get more GIBs, more funding, more research, more resources, you need to end up having to widen the appeal. So you come with this rhetorical tack that like, well, anyone can get AIDS. This is sort of a general health crisis.
Growing up, that was what was explained to us in school, was that AIDS is something that anybody can get. It actually wasn't even mentioned that it was a gay phenomenon, and the media started picking this up. And I'll give some people some slack because of the general confusion around the disease, of course, and also the lack of a sort of preventative, or not a preventative, but a sort of a drug cocktail that'll keep you alive for a long time. In absence of that, it was somewhat more scary than it is today. Plus the ignorance, I'll give people some leeway. But there are people like Oprah Winfrey who said things like, research studies now project that 1 in 5, listen to me, hard to believe, 1 in 5 heterosexuals could be dead from AIDS at the end of the next 3 years.
Yeah. This is like the pink ribbon campaign.
Yeah.
Where, I mean, that's what this is. And you're right, it is decoupling the gay community, particularly subcultures within the gay community, from this virus that they propagated. like the number of deaths from AIDS especially in North America is so overwhelmingly attributed to gays. Like it would be essentially almost a non-issue. It'd be scary, but it would be non-issue in terms of numerics if it had not been for the gay community.
That's in North America. In Africa, however, we shouldn't forget that it is a heterosexual phenomenon.
In Africa and in like Central Asia and Russia, yeah.
I would like to dispute that a little bit, actually.
Okay.
So I'm looking at the UN AIDS data here, the sort of latest data packet I could find about HIV in sub-Saharan Africa. So they do say about the main mode of HIV transmission. So they do say that heterosexual intercourse remains the epidemic's driving force in sub-Saharan Africa. However, I kind of question that because, so they say that sex work is an important factor in many of these epidemics, and that a third of female sex workers in 2006 in Mali were living with HIV, and infection levels 16.4% have been documented among sex workers in Senegal and Burkina Faso. However, keeping in mind that women basically cannot pass HIV on, well, they can, but it's extremely, extremely rare for them to be able to do that from to a man that they're having sex with. I think that sex work is probably not a major aspect of it. I mean, I guess I can imagine having, like, if a man's penis has like disgusting open sores on it or something like that, then he could be at risk. But just from regular PIV sex, it's hard to imagine how the penis could possibly get the lacerations needed to for the infection to actually occur. So,
well, isn't it like in South Africa, like 1 in 5, maybe 1 in 4 have AIDS?
Women or men? I
don't know. The overall population.
Yeah. I know it is true that a lot of them have AIDS. However, even the UN admits that injecting drug use is a factor in some places like Mauritius and Kenya, and there's a lot of unprotected sex between men is a more common factor than previously thought. So I know that even in the West, like, the blacks tend to be kind of a bit more ambiguous when it comes to their.
Let me offer another hypothesis based on your question, which is a good one. The odds of contracting AIDS are much higher if you engage in anal sex versus the traditional vaginal sex, and of course in Africa they don't really like condoms and everything. So I think if they're trying to prevent pregnancy, maybe that's one thing they do. I don't know. It's just a hypothesis. But just looking at the numbers, you would tend to sort of agree with what your hypothesis is saying, that it's not just vaginal intercourse that's doing it. Maybe they're doing it by other means.
There's a severe question, too, of like whether the infection rate is actually that high. So in 1985, the first sort of conference that's put together to try to address specifically AIDS in Africa, they define AIDS as, or the AIDS defining symptoms as prolonged fevers for a month or more, weight loss of over 10%, and prolonged diarrhea, which is literally just like the baseline that you get from like drinking the water. Living. Yeah, I mean there's like literally hundreds,
even in
if
South
not
Africa,
thousands
though?
of diseases.
Well, I do want to ask Kathy. So, could it be that they do a lot more of the eating at the poo-poo than they like to admit? Is that potentially what's going on here?
Yes, I mean, if you look at their racial cousins in America, I think that the rates for black men who admit to have sex with men is actually higher than for white men, if I can remember it correctly. So I think there's a lot more sexual ambiguity there than you might assume. And also, measuring any sort of statistics in Africa is basically impossible.
Yeah, they're not like shipping blood tests to the Central African Republic or something.
Yeah, exactly. It's all to do with probably clinical examination, and there's probably so many diseases in Africa that the modern medicine hasn't even encountered yet. That anybody with a sort of generic kind of immunodeficiency pattern would then be ticked as HIV positive.
So to be clear, you're just asking a question. You're not asserting. You're just wondering.
Yeah, I'm asking a question. I am doubtful that that women are able to pass on HIV to men, except in very rare cases. The way that women do pass on HIV is through childbirth to the baby, which obviously in Africa is also a major problem.
So I have some data to back up what Kathy's saying. Like the number one subgroup in the United States who are most at risk for contracting HIV from advert.org are Black African American men who have sex with men.
Mm-hmm.
By several thousand more than the second subgroup, which is white men who have sex with men.
Several thousand times more? Is that what you?
No, just several thousand more cases.
Yeah.
Annually.
Well, we all know they're slightly more promiscuous, and
the third group, Hispanic Latino men who have sex with men.
Also true.
Yeah, and also, I mean, there could very well be a difference in, a kind of a biological reason why baby blacks might be a little more susceptible to it, apart from all the kind of risk-taking and the sort of biosocial reasons. There's very good evidence to say that the immune systems of blacks and whites act quite differently. I covered a very interesting example to do with preterm labor in an upcoming episode of the Darwin Digest that I highly recommend. But basically, there's a lot of evidence to say that the immune systems are different. And another thing I do remember reading a while ago is that in Africa they don't like kind of lubricated vaginas. So the kind of the way
this is a weird anecdote. There's a term for it, like dry sex, or like you sit in bleach, dries everything out, makes super fun, I guess.
Gotta be kidding.
I also have some quick data to back up what Kathy's saying on immune system differences. So there's an allele. This is an older study. There's an allele known as CCR532. And it's found in higher frequencies in Europe and in Central Asia than in Africa. So like in parts of European Russia and in Sweden and other parts of Scandinavia, it's as high as like 13 or 14%. And this gives an incredible amount of immunity from HIV. Whereas all parts of sub-Saharan Africa, nearly it's around 0%. So like the UK, 12, Poland, 13, Spain, 10, whereas like in the Congo and Rwanda and other places, it's sitting at 0.
There's also a fairly strong hypothesis that there's at least some amount of a problem with needle reuse, particularly by clinics sort of out in the boonies of Africa, where it's difficult to get clean hypodermics. They may not even have autoclaves to do sort of a re-sterilization, which may or may not be effective, even if they do have autoclaves. And there are certain areas where it's extremely common to sort of just get street injections of get some vitamin B, perk you up a little bit when you're feeling down, that may or may not have the best needle hygiene as well. I've seen some statistics that try to epidemiologically estimate that. The highest number that I've seen, which seems to be an outlier in terms of how much sort of the medical consensus believes in it. The highest number that I've seen is that about 20% of the HIV cases in Africa are attributable to needle reuse. I've seen low estimates around 5%, but that's definitely an important transmission vector.
Yeah,
So-
I mean, I can also imagine that practice in blood transfusion in Africa isn't exactly up to Western standards. So I don't think they do much in the way of actual screening of HIV positives. And that's another way to guarantee basically an HIV infection is to get HIV-infected blood.
I heard Russia's having a problem now. Is that true? Central Asia, at least.
The problem in Russia has always been, and sort of Eastern Europe in general, it's always been a drug-using one. So,
Yeah. So this exploded. Hank and I were talking about this for the show. This exploded in Russia, in particular in the last 15 years, because of the U.S. war in Afghanistan. So with the poppy production, the poppy field production growing by several 100% essentially after the fall of the Taliban government, you had enormous outflows of heroin into Central Asia and through Kazakhstan. And I think there's documentary on the supply chain system. I'll find it, put it in the show notes, between Kazakhstan and Russia of heroin. And this has affected Russia in like a huge way, both in all across regions of Russia and in both rural and urban areas. So you'll find the same problem in Moscow that you'll find out in a small town in the Russian Far East, which is heroin use, but also other drugs. So there's the infamous crocodile drug, which is this synthetic concoction of like petrochemicals and other stuff. And needle reuse is a particularly important factor.
Is that the one that turns you into some kind of like reptilian?
No, well, I mean, kind of. I mean, maybe Kathy can describe it.
No, it creates almost a scaling effect, doesn't it?
Yeah,
Well,
it's
melts your
sort
skin.
of sores in your huge ulcers in your skin. Yeah, I think that's what it's called.
Yeah.
Yeah, grim.
I mean, I
Can't
could
we
never.
all just smoke opium like the good old days?
Oh, God.
Like it's not great for you, but on the other hand, it doesn't really spread disease. You just kind of chill out, like you're hanging around in the den. You're not causing any problems.
All it does is makes you it gives you erectile dysfunction. So it's it's probably not the worst.
Self-solving problem.
Would you rather have erectile dysfunction or turn into a reptile? I don't know. Viewers can decide.
Oh man.
So one quick question I think that I forgot to ask earlier, and for Hank and Kathy, what is the threshold point, and I think a lot of people are wondering, where HIV becomes AIDS? It's a point where the number of T cells per like cubic meter or so decrease to like irreparable to an irreparable point. Is that correct?
Yeah, it's the sort of the arbitrary distinction between sort of controlled and uncontrolled HIV. I think is 500 white blood cells per deciliter. Let me just check. I don't want to lie about
I've heard
that.
it's 200 for the. So one of the.
Well, what's the normal level, and then what's the AIDS level is probably clear to everyone.
So the normal level is so the normal level is it really varies. It depends if you have an infection, if you don't have an infection, but the normal T cell count in adults is from 500 to 1200 cells per milliliter. Okay. So I guess HIV is at least to my knowledge, is considered uncontrolled if the cell count drops below that. But then full-blown AIDS will be, tiny amounts of T cells, in the tens, that sort of thing.
Are those the same as white blood cells, or are those different types?
T cells are a subset of white blood cells.
Right.
The ones that HIV actually infects. So it doesn't infect any of the others.
Okay.
Yeah.
One of the sort of big drives that some of these organizations made was to have for the purposes of securing public benefits from the Social Security, disability insurance, and supplemental security income. they wanted a hard threshold diagnostic test so that it was easier to be diagnosed for regulatory purposes as having full-blown AIDS, so that you did not have to hassle as much, I guess, with going to the doctor and proving your symptoms and etc. before you were set up with subsidized HIV-positive housing and disability income and whatnot.
Yeah, so they came up with ELISA, ELISA is the acronym, in '85 to detect the antibodies to the virus in a bloodstream. And they, the first thing that they immediately started doing was applying it to the U.S. stored blood supply, because there was a legitimate worry that HIV positive blood had already been put into the system.
Which it had been. Like, you had several cases of hemophiliacs who do no fault of their own.
Right. So there's a particular one, Ryan White, a teenager from Indiana who contracted AIDS through a blood product because he's a hemophiliac. I mean, and this was after ELISA had been put in place. Like, clear. So they were proven right very quickly on. Like, okay, not only are there people probably who have been infected through bad blood products, but if we don't start immediately testing the U.S. has a huge blood supply on hand at any given time. Like, if we don't immediately start testing, this is where the spookiness and sort of the apocalyptic idea of AIDS comes in. It's because, oh my God, how much of the blood supply is contaminated, and how many people have been innocuously infected and are now spreading it.
Was there resistance to testing? Because I remember watching a movie, I think it was with Christian Slater back in the 90s, where he was like yelling at this committee of doctors, and he's like, give me a number about the number of people who have to die before you decide to test. And it was, I don't know, I was really young when I saw it. I'm like, oh, wow, rotten people in this world. But I don't know. I mean, were people just genuinely like, okay, like, should we spend $100 million on something that is not going to be helpful? Or because it's a legitimate concern to like not want to waste money when you have other things that need money to potentially help people in other ways. So I don't know what that debate was like, but it certainly was portrayed as like these kind of like curmudgeonly
if you really want to go down a rabbit hole, there's a whole digression we could make into the Arkansas tainted blood scandal, where you had prisoners, many of whom ended up being HIV positive, who were paid for donating blood, I believe, while Bill Clinton was governor there. There was some sort of a Clinton conspiratorial 80s style nexus there as well. But you had various sort of less than ethical blood wholesalers who were acquiring blood from very cheap and plausibly contaminated sources, like prisoners, like Haitians, etc., and selling them to hospitals without doing rigorous screenings of those blood products.
Yeah, I only want pure blood. I don't know if I want to buy cheap blood.
Yeah, you want to go with the premium,
exactly.
The high octane.
I think when AIDS first came on the scene, I think it was like, okay, this is a very technocratic issue. Like, all you have to do is maybe do some propagandization about, okay, here's things to do and things not to do. We're going to close down the bathhouses. Make sure you practice safe sex. You don't reuse needles. If you're going to shoot up drugs or whatever, don't reuse needles. And like very basic stuff. And then I think the idea of the U.S. blood supply and like random wholesome white teenagers getting infected without knowing, I think that kind of changed the perception of it. And I don't know how it was in Europe or the UK, Kathy, but in the U.S., I think that was the general zeitgeist of the AIDS epidemic.
I actually have a question with respect to that. So hypothetically, let's say when AIDS was picking up in the early 80s, you had some kind of national register of homosexuals, and they were rounded up and put into camps and.
Like in Chechnya.
Or Cuba.
Yeah. If there was an organized effort to crack down on the so-called, and I actually want to make this point as well, people have been throwing on gay community. I mean, it's an easy shorthand, and I'm sure y'all would agree with me anyways, but it's hard to describe men sodomizing each other and, quickly on their way to an early grave as a community. It's probably better to put an anti-community.
You throw this out there, so in Cuba, we have a very good case study of this. So when AIDS became a thing in Cuba, they did several things. I mean, Cuba is obviously not a socialist paradise. Nobody here is in favor of the Castro regime, but they were very effective. They mandated antiviral treatment for pregnant women. For HIV positive women, they mandated C-sections, which significantly reduces the odds of transmission to infants. Anybody who tested positive for any venereal disease also were mandatorily screened for HIV. HIV positive people were compelled to provide the names of all of their sexual partners for the last 6 months. And if you did test positive, they essentially put you in public health education boot camp for an 8-week course in, wear a condom, or we're going to throw you in the gulag.
There was a Cuban punk band in the 80s and 90s called Los Frikis, and they willingly inject themselves with HIV as a protest.
It's the signalarity.
As a protest against the Castro regime.
Well, the thing about Cuba is that their death rate per capita was 35 times lower than in the USA. So, I mean,
you mean due to these preventative public health measures,
right? And I have no idea what the sort of incidence of homosexuality or intravenous drug use is in Cuba. If it would have been as much of a problem, even absent those measures. But honestly, those measures don't seem that terribly onerous compared to other things of that nature that we enforce via public health measures. And they were empirically effective, as they say. But of course, this was bandied about. I think there was more of a desire by the gay community. I keep throwing up air quotes around that whole thing because it's certain elements within that who are extremely leftist, who wanted it to be perceived as oy vey, they're going to throw us all in camps. They wanted that to be the narrative as sort of a mechanism for reinforcing their notion of being a oppressed subculture, and to get by proxy affiliation and sympathy and everything else. So
it's the homosexual cries out in pain as he sodomizes your children.
Yes.
Yeah, I mean, it would have been more cost
Why do they persecute me so?
Yeah, I mean, it would have been more cost effective to take the Ramzan Kadyrov approach, which is literally just camps for the gays. It would have been more cost effective. It would have probably slowed down the rates of infection into the heterosexual population, or the bisexual or experimentation population.
Down low population.
Yeah, it would have. I'm not kidding. It would have slowed the rate of infection, or even if you took.
Well, I mean, Cuba was a lot less aggressive than that. They didn't have camps for gays. It was primarily based on whether you tested positive, and then at that point you were basically sent off to 8-week grids camp to make sure that you knew damn well to wear a condom or get gulagged next time.
Maybe they should take those gay cruises that everybody talks about. Just keep going. Just keep going.
As an example, the estimated lifetime cost of treating HIV in America is almost $400,000.
Because it's heavily subsidized.
Yes.
So, like, there was a point in time in which, like, circa 1986 or so, when AZT first became available.
Oh, yes.
The first AZT became available in 1987, and as a low-volume experimental drug that had significant development costs for it. In 1987 dollars, it was priced at like something like 10 grand a year or something. Which, because it was new and relatively experimental, was often not covered by insurance or Medicaid or Medicare. And there were a huge number of extremely effective PR campaigns by various gay advocacy groups to get the price reduced initially, and then to have the cost ultimately borne by the taxpayer.
Wasn't this the subject? I didn't see it, but wasn't this loosely the subject of that Matthew McConaughey movie, Dallas Buyers Club?
Oh yeah,
like smuggling it in from Mexico, etc.
Right.
Which so this, if you read some of this literature, the thing that's the most interesting is like when you talk about gays with enough resources and agency to do something like move to San Francisco. Like, you're talking about a fairly highly selected group of people. Like, they're people who have the ability to do things like successfully engage with the political process. They're able to, like, make plans, coordinate, share resources, like, extract resources. So the whole thing ends up being kind of a case study in, like, how effective can, like, a basically genuinely grassroots political advocacy organization be in America, given the sort of like interaction points and pressure points that you have with the government. So,
if I can give some numbers on the assertion that AIDS is subsidized, in the United States there are about 1 million people who have or are diagnosed as having AIDS, and that's less than 1% of the population. Compared to cancer, where there's over, I think, 10 to 12 million people, which is about 5% of the population. It's obviously much less of an issue. However, in terms of public National Institute of Health spending, the AIDS spending is almost as much as cancer. And so if you broke it down by per person, whoever has cancer or HIV receives over 5 times as much funding as cancer patients do. So about $2,500 per person versus under $500.
Is that funding just to keep the pharmacological machine running, cranking out the pills and stuff, or is that how much of that goes into like research to find new ways to keep
I think it's research
going?
I mean, this is a research
that's like there's a huge amount of just like buying the drugs, like the hospital stays, etc. Is enormously expensive.
Well, that's a separate issue. The statistic I'm citing is NIH, so I think that's for research.
Yeah, those are research grants given to private organizations, hospitals, and universities from the NIH. So that's your tax money going to solve or attempt to solve a problem that is easily prevented through like just being a normal person. So not shooting up heroin and not having gay sex orgies.
Or more effective government measures like we've seen in Cuba.
Well, and the irony is that like they basically solved the problem.
Right.
They're like, if you want to do like prevention mechanisms are 100% understood. Like, and treatment has also advanced to the point where like, given the current state of the disease, like absent like some catastrophic evolution or like emergence of some other strain or something, like it's totally possible to like live for 40-50 years like being HIV positive, and there's like a significant population where that's happened to them. Like, you know, they somehow contracted AIDS like in the mid 80s and they're still alive and kicking. Like, there's not a lot of them because like the early batch died out before antiretrovirals and drug cocktails were available, but like it's completely treatable.
Yeah, I think what we need is somebody to pull a Shkreli and like raise the price of all the HRT therapies to like the point where the state is bankrupted trying to care for these people.
Yeah, that actually goes. There's an old TRS term called swivel down economics, and it's basically like the idea. It ties in more like microwaves and high def TVs. But the Shkreli approach was actually he was
going to jail, by the way. But
yeah,
not for the drug stuff. It was for a different swindle.
I don't know. I mean, you might
also he
did
nothing.
Did nothing wrong. Yeah,
he did nothing wrong. Everyone press F to pay respects. But basically, it's this idea that if you jack up the price, you incentivize more R&D into creating cheaper alternatives, and you're not having the government subsidize it as much as you're having rich people or private advocacy organizations with private philanthropic donations do the majority of the purchasing.
Which, you know, when you talk about AIDS organizations, like nonprofits, quote unquote, that deal with AIDS treatments are all heavily government funded.
I mean, he actually gave a presentation not long ago on why he did it. He gave it at I think maybe Boston University. He gave a full like 45-minute presentation on the economics of the drug sector, and like he tried to lay out his case like, hey, here's why here's why I had the price raised. And he tried to make it out to be more humanitarian. I don't know if that's he's a pretty advanced troll. He could have the whole thing could have been a troll. But I think some of it was an insight into how the drug sector actually works. And there's a great moment where he like gets into an argument with some academic there who essentially accuses him of like, you know, of a homo holocaust. But the reality is that there are genuine economic factors into this, and it's not just like people hate the gays. Like, it's expensive, and because it's not a widespread virus, and because it's limited to a certain mostly a certain subculture, at least in North America, like there's not a lot of impetus for people to be down with giving away a ton of money to solving it.
What I wanted to ask Kathy about, I've heard about med-resistant AIDS. Is that a thing?
Yeah, I mean, yes. So HIV, if people who take HRT don't adhere properly, then the virus that they have can become resistant. So they need to take a different kind of cocktail. That's basically, and I mean, there have been cases of, you know, people becoming completely untreatable because of poor adherence to therapy. So that's kind of the extent of it. The one that's really interesting now is the PrEP resistant HIV. I don't know if you guys want to talk about PrEP.
If you could explain that, that'd be great.
Sure.
Is that Truvada? Is that a PrEP?
Yeah. So Truvada is now used as this sort of prophylactic therapy for gay guys, basically, who won't put a condom on. And this is in the UK, for example, is now being funded by the NHS. It's in other parts of the world, it's also becoming state funded. So imagine that, like just imagine that for a second. You're basically your tax money is going to making sure that your local faggot can be free in his bathhouse. So
there was a huge thing recently with the NHS with that in the UK, right?
Yeah. So they were kind of hesitant about funding it at first, but now they've just given in and they are funding it. And so yeah, I was just looking at cases of PrEP-resistant HIV developing, and this is particularly dangerous if somebody has just contracted HIV. but it isn't yet, you can't yet see that on a test. Then they can go on PrEP, and then the HIV will obviously become resistant, and they'll have to go on full HRT after that. But yeah, I think it would be interesting. I mean, eventually you can imagine, just like with antibiotic resistance, it's kind of a eternal hamster wheel of us being just a step ahead of all those bacteria. So it's kind of the same with HIV. I mean, the kind of populations that take HRT aren't exactly the sort of most low time preference, high IQ populations. I mean, gays kind of being a sort of semi-exception to that, because they do tend to be kind of, they're not the dumbest people, but they have their own different issues. So you can see adherence to HRT isn't brilliant. So I mean, eventually it will just be it's a matter of time before all the therapies that we do have become ineffective.
I mean, the rise of the super antibiotic resistant gonorrhea and chlamydia around the world now. I think the World Health Organization has been has officially put out the major warning. Like, not only is this going to be a problem, it is already here, and it is because people can't follow through on taking their antibiotics every day of the week that they were prescribed them to get rid of their chlamydia, and then they immediately go and have sex.
Yeah, there's like a huge when you look at the statistics for like co-infection rates, like you never just have one STD when you look at these statistics. Like, it's often a co-infection where somebody's got the herp, they've got chlamydia, they've got gonorrhea, they've got God only knows what else. Maybe they're on the Truvada train, so like they haven't acquired AIDS yet, but like it still like looks like fucking Vietnam from the waist down. And each of these things like increases the risk of transmission.
What is that reference?
Looks like Vietnam from the
Why did you pick that country?
Just craters and mud.
Oh,
our diplomatic relations with Vietnam just cratered.
But each of these things like massively raises your risk of transmission in both directions. So they tend to become comorbid, and especially because like when you look at the behavioral epidemiology, like if you are a junkie, so you're like shooting up and you need to get money for your heroin, so you're also a prostitute, and like all of these things just like end up being one enormous diseased morass. And so like this is also a population that has a real problem sticking to like 7 to 10 day treatment regimens, or like making their appointments that were set up for them to get screened for this thing, or like picking up their phone when their screening results come back in. Like, I mean, you could construct a syndrome that's just like, fucking generally shitty person syndrome. Like, he's got the GSP.
You become a mugwump.
Effectively, this is actually all the fault of really low agency. I mean, the low agency is part of the low agency, and I guess like high time preference is basically
and opportunity. I mean, let's just be honest.
But these are actually like really what caused AIDS to blow up, even within this subculture. Like the bug chasing thing. I mean, I'm not gonna do Naxalt for all gays because I don't really give a shit about them, but it is only a small part of their little ontology. I don't.
Yeah, that's a minority. There's no way.
I think
vast minority.
I think really what it is it's just low agency and high time preference. Like, if you are infected, maybe you should not go to the bathhouse. Or if you hear about an infection coming from someone who went to the same bathhouse you were going to, it would never occur to these people like, maybe I shouldn't go to that bathhouse anymore.
I mean, it's not even that. It's like, so one of the more famous philosophers of the 20th century, also one of the more famous AIDS deaths, Jean-Michel Foucault, like, you know, his entire body of output is basically civilization, society, government. It's all a conspiracy to stop me from getting my cummies. Like that's like the sum total of his philosophy. And if you apply that, like, it's even orthogonal to the notion of like time preference. It's not even that, like, well, you know, like if I don't get the grids, then like I can be banging into my 70s as like a really degenerate old man. It's like, no, like I gotta get those cummies. I gotta get that bathhouse action. Like there's no like it's like a sort of like an a priori like priority, like that's this twisted conception of like that's what your life is for.
So E. Michael Jones has talked about Michel Foucault as being the encapsulation of the triumph of the sexual revolution and the homosexual agenda. So basically, like this idea that when the left lost the labor portion of their platform globally in the 70s, the conceit or the concession was, okay, yeah, you don't have to stand up for labor anymore, but we'll let you get away with whatever sexual deviancy you want. And Michel Foucault propagated this highly. I mean, you're right. All of his writings, for the most part, are
it's biopower, man. Yeah. They want to control your body.
So, in like 87 and 88 is when this really started to become like, you know, the global apocalypse mindset. So by December, you had 71,751 cases of AIDS had been successfully reported to the WHO. And 47,022 of those were in the USA. Now you can attribute this probably to bad reporting coming out of Africa. Like who knows how bad it actually was in Africa, because it seems like, based on things like The River by Edward Hooper and a documentary based on that from Channel 4, The Origin of HIV and AIDS, reporting in Africa and that the health infrastructure that the colonials had attempted to leave behind had wholly collapsed by the 80s. So who knows how widespread it really was, and if there was any way of actually confirming. But the WHO also thought that anywhere between 5 and 10 million people worldwide had HIV. And not only every continent had a reported case of HIV, maybe with the exception of Antarctica, but every region in every continent was reporting HIV. So not just Asia, but Central Asia, Northern Asia, Southeast Asia, India were reporting HIV. In South America, Chile, Argentina, Brazil, all 3 countries in North America, nearly every country in Europe were reporting cases of HIV. So as globalization increased and as homosexuals are able to have sex with whoever they want around the world, HIV spread precipitously, pretty much everywhere. Nowhere was safe from HIV. And then in 88, the 1st of December was declared World AIDS Day by the WHO.
There was also in May of 88. I was not paying attention at this point, but some of our older listeners may remember this, because apparently the U.S. Surgeon General, C. Everett Koop, sent a 8-page condensed version of the Surgeon General's report on AIDS called Understanding AIDS to every single U.S. household, all 100 million plus of them, which is like a major thing. Like, you know, you have the government like deciding that this is enough of a priority to disseminate this to like literally every man, woman, and child. that they can find in the entirety of the country. You can actually find the pamphlet online. It's fairly well reasoned. It replays all of the like half-truth tropes about like, well, anyone can get AIDS, et cetera, et cetera. But their description of the behaviors, treatments, and prevention seem to be fairly accurate, even as the years have gone by. But this was, definitely a major priority of the entire medical establishment and government.
I'll go into defense of at least the awareness campaign, because in contrast with something like cancer, HIV is an infectious disease, so you can spread it. And in theory, the more people who have it, the more likely the rest of the population is to get it. So it can kind of go out of control. And so I would say that it is reasonable, even if you have to kind of dramatize it a little bit, it is reasonable to try to scare people straight into proper sexual behavior. Now,
emphasis on straight.
There you go. It was obviously not targeted at the most likely population to be spreading it for political reasons, but nonetheless, I would say that the general education campaign was probably a wise one, even if it was misdirected.
It's a worthy endeavor. It's unclear sort of at what point they really start to find some of the micro level epidemiology of this. So I've just for some numbers about like the modeling of how much of a problem this is for like your sort of normie heterosexual population. The usual number that's thrown out for risk of transmission from just generic heterosexual PIV sex is about 1 in 900, or 0.1% approximately. But that's actually asymmetrical. The odds for female to male transmission are a half to about an eighth of that in estimation. And even that is like conflated with the co-infection with other STDs or IV drugs that we've seen in the past. And like this gets so small that it's actually, I've heard the claim made, and I've been like able to duplicate it in my inability to find a case. But like you cannot find a single case of female to male white HIV transmission through PIV sex where there's not some like conflating case of like intravenous drug user or co-infection with some other STD. Like you literally cannot find a single case of this happening.
Yeah, that's exactly what I was saying about the transmission in Africa, and the claim that sex workers, female sex workers, are responsible for passing HIV on. I'm just extremely skeptical of that because of this biological fact. So it's important to reiterate that, I think.
Yeah, I
so,
mean, like
so they can carry it and give it to their children, but they can't spread it to other men, is what you're saying.
I think it's extremely unlikely, unless they're also sharing like drugs but through PIV sex. I think it's minimal the chances of them spreading it.
There are definitely, like, honestly, like as of the current state of epidemiology, like there are things out there that you should be more worried about just from a pure symptomology perspective than AIDS. Like, drug-resistant gonorrhea or chlamydia or syphilis is no joke.
Drug-resistant syphilis in particular is gonna be really nasty.
That's nightmare fuel.
Yeah. That maybe Kathy can speak to that, but that actually like legitimately frightens me in a really eerie way. The drug-resistant syphilis.
All this talk of other diseases reminds me of just growing up and how the education was sort of taught to us. I mean, condom use was maybe the probably most common one, but abstinence was not exactly the most popular one in the secular education system. But if you just look at kind of the mass media and compare it to that, it's like basically everybody's like, well, you just need to get tested. That's the best thing you can do, because you want to know before you engage in these random sex acts with different people, because you don't know. And nobody, of course, does that. But it's like the most ineffective, impractical solution to something that could be solved pretty simply if you took a different track. And so I just compare this like American approach to the Cuban approach, for example, and just see how stupid the culture is, where basically just having a little personal responsibility would actually go a long way, rather than dumping all this money and time into these advanced medical procedures. I don't know. I think we need to grow up as a people.
So my understanding is that there's a growing strain of penicillin and antibiotic resistant syphilis that can potentially be worse than getting HIV/AIDS. Is that accurate?
Well, yes. Worse in the way that, in a sense that it's less treatable. Obviously, yeah. And third stage syphilis and neurosyphilis is not very nice to have. Basically drives you insane. There are cases of completely penicillin resistant syphilis. From the quick research I've done, I couldn't really see if it's resistant against last line antibiotics, but that sort of treatment, it basically is almost as dangerous as the disease itself. So
yeah,
I mean, I wouldn't be worried about it. Like, just don't go around screwing thoughts, and you'll be all right.
Yeah.
But I for one welcome multi-drug resistant STDs. I think it would be wonderful for society. So
it's a tremendous social experiment.
Yeah.
I wanted to ask Kathy, from the European perspective, what the public health message was to the population. How did the government, how did the media talk about AIDS in maybe the 90s at least?
Yeah, so in the 90s, kind of growing up in Eastern Europe, there wasn't much focus on the gay aspect of it. It was more seen as a IV drug user problem, which it is in Eastern Europe more than anything else. But I think sort of later on, it was always kind of portrayed that kind of anybody could get it, and you need to be super careful. Don't you dare kind of it was kind of treated.
Did people start behaving more carefully when engaging with people sexually? Ryan Landry makes this point about in America how during the 90s, because of the fear of AIDS, people started using condoms more and being less promiscuous compared to the 70s, most certainly, but also the 80s.
Yeah, I mean, you can. Yes, I think that's true. I mean, the most common method of contraception in the Soviet Union was abortion, so that definitely fell. Yeah. And that did go down in the 90s. I'm not sure how much of that is kind of due to the AIDS scare and how much of that is due to other factors. But it's because I wasn't. I was just a child back then. It's hard to remember any kind of. It wasn't like a message that I ever got in school or anything like that. It was only things. Once I had access to the internet, it was only the kind of thing I could see there, and that was all Western sources. So it wouldn't be any different than from what you received.
Sure, and just from your own personal kind of social circles, did you feel like people were worried about unprotected sex, or was it not an issue that was more about the needle sharing?
Yeah, I mean the sort of the unprotected sex aspect was just more of a fear of pregnancy than anything else, because taking kind of hormonal contraception, especially as a teenager, there was like a stigma to it. You needed parental permission. A lot of parents wouldn't give permission for very good reason.
Well, I've heard it's not good for women to take that.
Of course it is. It's very no good. I mean, nobody tells you that, but
yeah, right.
lots of people I know were very suspicious, and parents wouldn't give permission because obviously for the health aspects and then the promiscuity aspect, it's still not something that people take pride in Eastern Europe. I don't think the notch count is not something that you will write a blog about. so yeah, I don't remember much of an AIDS scare. I think it was a lot more prevalent in the West as such, but that's just my personal experience.
Yeah. So in '84, I think it might have been the world's very first needle and syringe exchange program was set up in Amsterdam. Because why yeah, I mean, why try and just prevent people from doing drugs? And you can just let them continue doing it as long as you make sure they don't spread the gay.
I mean, people have been like using opioids for several hundred years. Like, if you could stop it, then it probably would have been stopped by now. Like, it just seems to be something that humans are sort of into.
Unless you view this is sort of a self-correcting issue that in this case the Dutch government was not interested in really solving. Like, you could have just said, you know what, if you're out there injecting heroin or what else into your bloodstream, good luck. We're not like setting up a taxpayer funded program to facilitate that.
That works in Libertopia or Ancapistan, but when you've got a generous welfare state to provide them with treatment for the diseases that they then acquire.
I'm speaking not from reading anything. This is secondhand from admittedly more liberal friend of mine, but he basically told me that I think it was in some place like Amsterdam, like Netherlands at least, that they did set up these sort of needle exchanges because they were sort of like, this may not be the exact case, but you get the general idea. It was sort of like if the government was monitoring the exchange, which they assumed was going to happen anyway, they could do it in a more safe fashion so they could sterilize them, for example. As a general approach, his argument was that if you essentially just look at what works and you actually do the research rather than having kind of these more philosophical points of view about like personal responsibility. If you screwed up, it's your fault. Then he said that you could actually reduce the health risk. And I think there's some validity to that argument. That's assuming, you believe these people deserve to be helped. But if you don't, and if you think it's their fault, then yeah, that's the more libertarian point of view.
Yeah, I mean, I'm completely, having moved away from my ANCAP roots somewhat, I am still completely in agreement with the ANCAPistani public health view of this sort of thing. Let them just die, as far as I'm concerned.
But if they're not a risk to anybody else, so that's where it gets tricky. If they actually do represent some risk to, I guess, heroin needle exchanges is kind of a closed group, but in the case of AIDS, and if it's admittedly not likely if you're doing it heterosexually, but if it's a risk to the general population, I do think you have an argument to make, like the Cuban case, where you do need to have sort of a government intervention where it's a health risk to everybody else.
Yeah, I guess maybe like mandatory AZT therapy, which is like the most unpleasant one with the most side effects, would be appropriate punishment.
You get the Ford Pinto of
like
the antiretrovirals.
The two Kevin show talked about this. That's where like the AIDS face, as it's known, comes from. It comes from AZT. It's not necessarily having HIV or AIDS. It's like the retrovirals and attempted treatments were so bad for you. They pretty much just totally nuked your system.
Oh, this is real gross pictures here.
Don't share, please.
I don't remember them talking about this on Will and Grace.
Yeah.
Well, they talked about it in Philadelphia, right? The Tom Hanks movie. Anybody want to bring that up? I actually haven't seen it. I just remember all the media hype around it. I never saw it though.
So brave. So brave.
So if you consider that in the late 80s and early 90s is when the culture war simulated the AIDS epidemic into its grasp. You had Freddie Mercury, the lead singer of Queen, who announced he had AIDS and promptly died thereafter. You had Magic Johnson, probably the most famous case, who contracted HIV. He contracted HIV and never had AIDS.
You also have. I'd be impressed if any of y'all know Klaus Nomi.
No, I don't.
Yeah.
Yeah, he was a German. He had a very high, I think, falsetto. He did this really weird new wave like opera stuff, and he died of it, I think, when it was still grids.
Yeah, there was like Rock Hudson and some other people like earlier on, and
Liberace.
Yeah.
George Michael died recently of it.
Like, he could rattle these off for like hours. Like,
yeah, and
well, you know what I found was interesting, to me at least, was that when you saw a guy who died of AIDS and you didn't know it was gay, you usually found out he was gay.
Correct, or experimented is the politically correct term. He experimented.
Yeah, like Charlie Sheen.
Then that might have just been from hookers. I mean, who knows?
Or Vatican.
He might be an exception.
Male hookers.
Yeah, male hookers. So,
It was. I mean, he was letting trannies. Well, fuck him.
The interesting thing is that the U.S. in the 90s, or I think in 1990, actually was banning people from entering the country if they were HIV positive.
Wow, what a thought.
As well they should.
And
I mean, you remember the Ebola thing where Trump was talking about stop the flights, stop
yeah.
them.
Well, it's like it says on the Statue of Liberty, bring us your poor diseased faggots.
Yeah, that's exactly what it says. Especially
it'll say that soon.
Yeah,
if Stephen Miller has his way.
So basically, the 6th International AIDS Conference in San Francisco attacked the U.S. immigration policy, and this is when George Herbert Walker Bush was still in office, and there was a Republican Congress, and there was no way. And even the Democrats at the time were just not, this is 27 years ago, were not interested in telling their constituents we were totally okay with more HIV people coming into the country. And the usual NGOs boycotted and they were fed and so on. But by 91, you had the 3 major events: the introduction of the Red Ribbon Project, Magic Johnson announcing
Who
it
paid
HIV.
for that? Was that a government thing?
The Visual AIDS Artists Caucus.
Visual AIDS.
Oh, Jesus Christ.
That's amazing.
So
Yeah,
I don't know who's behind. I could actually look it up really fast. Who is behind the Visual AIDS Artists Caucus? Oh, give me a sec.
Who could be behind this?
Yeah.
Rubs hands vigorously.
This is. We can maybe cut this interlude out while I look this up, but.
Red Ribbon Project. It's yeah, you can go down the rabbit hole with tracing all the funding streams. It seems as though at some point in the 80s, probably as you saw ACT UP, the sort of more political organization get founded, it just became part of the entire leftist nexus. So you started to see a bunch of funding pouring in from places like the Carnegie Corporation, the Ford Foundation, all of the traditional bêtes noires into these advocacy organizations that would then sort of conflate the HIV education and outreach with my leftism, my immigration policy, like my anti-discrimination, intersectionality, etc.
So it was a group. It was a group of Manhattan artists, and based in New York. And
who paid for them? I mean,
I don't
artists
know.
don't exactly make a lot of money.
The two major guys were a man named Patrick O'Connell and Mark Happel. Maybe our listeners will do the deep dive for us on this funding stream. I'm not seeing anything.
Well, I do recall
immediately obvious.
Bill Gates stepped down from Microsoft and followed his wife's path and decided to give all his money away at the Bill and Melinda Gates Foundation. One of the big things that they were touting was AIDS research, I believe, or at least AIDS prevention measures in Africa. Could be mistaken, but a lot of their work went into Africa with the mosquito nets.
Yeah, that was like the one. That was like a big George W. Bush initiative when he was part of the government.
Yeah, he announced that
with the Clinton Global Health Initiative, which seems to be the more sort of well-regarded part of the Clinton machine.
So these are the main people behind this are actually curators of art museums. So you could easily trace the funding from groups like the Ford Foundation and other philanthropists through these art museums to this organization. So the main guy is Bill Olander, who had the New Museum of Contemporary Art in New York City. You had Thomas Sokolowski, who was the director of the Andy Warhol Museum, Gary Garrels, chief curator of the San Francisco Museum of Modern Art, and then they brought on Patrick O'Connell and later Mark Happel to actually lead the organization as executive directors. Now all these guys were gay too.
No. There's a hilarious anecdote, like, so as like the sort of notion of, you know, AIDS benefits, like awareness campaigns, etc., becomes more institutionalized and more ultimately meaningless. There is a incident in the 1990s, a fundraising event on the Atlantic Ocean beach on Fire Island, which is a notorious gay resort, evolved into a major circuit party and developed a reputation for being connected with unsafe sex and recreational drug use at this fundraising event for the Gay Men's Health Crisis Organization.
Maybe they should call it Flamer Island.
Yeah. Well, they ultimately pulled the plug after 1998 when a man died overdosing on GHB, and 21 revelers were arrested for drug possession. So like you've gone full circle from like organizations devoted to like, hey, maybe we should stop the orgies until we figure out what the hell is going on. They figured out what the hell was going on and then started fundraising to fight the disease, raise awareness. And then it developed into an orgy again. Like 360 degrees.
Now you've gotten to the point where like the push is for, they say, stop the stigma, because, you know, apparently having a communicable disease that can potentially kill you or at least leave you living a disease-ridden life is a stigma. And I'm looking at here on one of these homosexualist websites. They have like a list of 10 sexiest men with HIV.
Oh God!
Are they glorifying it now?
Real
ridiculous.
I mean, it's gotten to this point. I mean, someone has to stop these homosexuals. Like, these people.
I remember back when it started, it was like God's going to stop them. It was like God's punishing you, and that was kind of
like
resistance.
You have like a perfect example of this sort of like spiral into just complete leftist degeneracy. So in San Francisco, you have ACT UP San Francisco and you have ACT UP Golden Gate. And ACT UP San Francisco is apparently just made of completely insane people. They have rejected the scientific consensus regarding the cause of AIDS. They have linked up with PETA to protest against animal research into HIV treatments. They've begun throwing fake blood and real spit against AIDS charities attempting to fundraise in the city, and of course,
this is what Roger Scruton always calls the red-green alliance, where you have the red left aligning itself with the green movement, and whatever cause either one takes on immediately transforms itself into just a political abomination. So
They're can't watermelons, even, green on the outside, red on the inside.
Yeah, I mean, you can't even, now the environmentalists are getting involved in AIDS, which is a public health thing for human beings. It's so beyond the pale retarded at this point that we're allowing the political dialectic to decide what to do about a public health crisis.
I have another question, Kathy. So I've always been confused in recent years. Part of this destigmatize gay cancer led to this demand that was acquiesced to, that homosexuals be allowed to give blood. And so my question is the disease communicable in that way? Because obviously that would be an insane thing for actual AIDS blood to be given to people.
Blood transfusion has a 90% chance of infecting someone if that person who's giving it has HIV.
So am I wrong that they allowed this? Because I've heard that they allow this.
They are sort of making the restrictions a bit easier. So currently, I think in most countries, they say a gay man can give blood if he's not had sex with a man for a year, which is basically impossible. I mean,
and how do you verify that?
Never been done.
Yeah. How do you verify that? Exactly, you don't. But I think in the UK at the moment they're pushing to push that number down to 3 months, if I'm not mistaken, or something like that. So even that stipulation is seen as too discriminatory and not inclusive enough.
So, see, if I can
don't ever need a blood transfusion in Britain. That's all I'm saying.
If I can interpret this strategy, somebody mentioned the green-red alliance before. What I would sort of call a lot of this political strategy generally is a very self-interest group minority browbeats the general population or the people who have money through a variety of media campaigns who get funded for various political means to then change public policy for their own selfish benefit. And they do it through public shaming. And most people, it doesn't directly affect them, but they don't want to be called, cruel or mean or something. And so they acquiesce. But you do it over and over and over again on separate issues, and it starts adding up. And this is the strategy they've been using for so many issues.
Because remember, the purpose of donating blood is to make faggots feel good about themselves.
Same thing with trannies in the military. I mean, what are we doing here?
The insanity of this. I mean, it's like this is it's supposed to be for people who need blood, and it's turned into some kind of homo justice vehicle. Yeah. I mean, what absolutely infuriating, to be honest. It's really disgusting.
I agree.
They use philanthropic organizations, and I think to an extent philanthropic organizations use them. There's a feedback loop here to shame you, right? And the best thing to do is just to immediately stand back and say what Nick always says is, I reject your premises, faggot. Like there's no, if they call you a bigot because you don't get, that is their premise, that you are a bigot because you do not want to help the gays with their feelings and their public health crisis somehow simultaneously. You need to just step back and say, I totally reject that this is completely insane. if you want to get into it, like currently in 2015, or not, I mean not currently, but the most recent data we have on the number of people with HIV annually is around 36.7 million people now have HIV.
Wow.
Worldwide?
Wow.
Worldwide in 2015. Now that is...
Yeah, there's only about 1 million in the United States.
I mean, that's probably bad reporting, and I'm guessing that that's a low ball. I'm going to guess that in 2017 it's probably around 50 million.
Most of that will be in Africa.
Yes, overwhelmingly in Africa, overwhelmingly in sub-Saharan southern Africa. But it doesn't help that in this age of globalization and in this age of like sex fetishization of Africans and just having sex with foreigners, like this will not continue to spread, and you can't even object to it anymore. You can't even say, you shouldn't go have sex with people with AIDS or HIV. You just shouldn't. Even if you're protected, you just shouldn't have sex with them. You should avoid them. You can't even make that part of the public health response to the crisis.
But you're denying them sexual rights. They
Exactly.
have the right to have sex with you even though they can get you dead. Don't you understand?
Yeah.
But
And
sex is a human right.
That's right.
Yeah. I mean, at some level, this red-green homo political dialectic is probably literally going to get all of us killed, because they're at some level.
Oh, I think it's just going to lower our quality of life.
They are going to eventually win this battle with trying to limit the amount of HIV positive and AIDS positive people who can give blood. And if they remove the screening process as a means of saying we're not trying to discriminate, I don't
think that will actually go forward if it starts causing problems. But
yeah. So
I doubt
in
people will put up with that.
many areas, like the blood donation process is actually used as a very shitty, which doesn't even make sense because HIV tests almost everywhere. You can get them for free easily, but people will use donating blood as a HIV test effectively. They will donate blood and then call the clinic the next day and be like, "Hey, you might want to test that."
Oh my God! These people need to be punished. I'm sorry. It's beyond
but I mean, like
ridiculous.
as a result, yeah, like I don't know what the sort of total screening of like the blood supply, like that seems like it would be a very technical process. It's not like there's a big vat of them, like it is like single donor, single packet.
And it's very expensive. The money you need would be astronomical for that sort of thing. That's why it's not done.
We could just relocate these blood transfusion centers to bogs, and just you have 2 doors, and you when they test you, figure out which door you go in. One door leads right to the bog.
The choice of the bog is the means at which you dispose of the infected. That's very interesting. In the plague, they used to just board you up in your house.
Yeah. I mean, we briefly mentioned the bubonic plague in an older episode on Malthusianism, and the approach was essentially like if you got infected, that was it. Like no one was talking to you, no one was going near you, and there wasn't going to be a lot of help from the apothecaries. And maybe through no fault of your own, but those were legitimate steps taken to try and limit the impact of this plague on the population of Europe.
Yeah, conditions were truly abysmal. I think it was 30% of the population may have died in Europe. In some countries,
something like that.
Some areas more, obviously, but I think that was the total average.
We can also brand these people with maybe something like a pink triangle, so we can identify them.
They'll just take it
off. Give them a one-way trip to Chechnya.
Yeah. Well, I heard there's no gay. I heard they have no homosexuals there.
Well, maybe they need some. It's not very diverse of them.
State-enforced homosexuality for the Chechens.
The problem is they all go underground, and so they won't come forward. That was actually the sanctuary city logic, is that if you don't allow illegals in your city, they won't snitch on the other illegals because they're too afraid to come forward to tell you that they're illegal too. So I don't know, the arguments that are made are
they're all in bad faith.
Yeah, but it's sort of like the logic. I don't know if it's actually bad politically, because it obviously seems to be sufficient for getting these people into power, at least in the United States. So how do you combat this? I don't know if it's with logic. I think it's maybe with something else.
Boggs. It's with Boggs. I'll tell you.
Yeah.
I mean, so the data, if you go to ourworldandata.org and you look at HIV/AIDS, the number of people, the gross number of people with living with HIV has increased. And the resources spent on HIV in 2012 were $18.9 billion American. So one of the common arguments is that they'll say, well, the percentage of people with HIV has gone down relative to the population of the globe. That's just because more people are being born. The reality is that the number of HIV cases is continuing to increase, and the world is spending more and more money on this problem and effectively getting nowhere.
What about the United States? Do you know if it's gone up or down as a percentage of the population?
I do not actually have that on hand at the moment.
The media campaign has certainly died down. I don't know if the caseload has dropped.
The U.S. actually doesn't give a lot of data typically to these organizations on HIV and AIDS. Like if you look at a lot of these graphs, it always says no data available for the U.S. in many cases. So
That's
I don't
bizarre.
know what the cause of that is. It's similar to Russia, where they're just refusing to report it. My suspicion is that the problem is bad in the U.S. It's always been bad. Especially within the gay community.
In the United States, gay and bisexual men aged 13 to 24 accounted for an estimated 92% of HIV diagnoses among all men in their age group.
There
Jesus
you go.
Christ.
Yeah, I don't know. I don't really have anything else to say on this. I pretty thoroughly grossed out and angry. Kathy, if you want to, you have any closing comments for us on this plague of humanity?
Yeah, I think while the HRT treatment works and is affordable, to the government and that, I think the big sort of fight right now is quote unquote AIDS acceptance, is where we shouldn't shame somebody because of their HIV status. I mean, wasn't it in California they decriminalized if you knowingly give someone HIV or something like that?
Just recently, San Francisco, I think his name is Scott Weiner, who's gay and Jewish, and he wanted to decriminalize the having sex with others if you're HIV positive and you don't tell them. So he thought that'd be okay.
Yeah, I mean, it's apart from the financial burden of HIV, I don't think that it's a problem that we need to be too concerned with, purely because it's, from what the evidence tells us, it is minuscule in the sort of the normal, in normal people. And, what happens in any kind of disease that reduces number of Africans must be a good thing. So, yeah, all I can say is carry on, and I look forward to med-resistant AIDS as well.